Hey guys, what's going on? This is John from Friends with Your Benefits. Did you know that approximately 20% of women will unfortunately suffer from some form of infertility during their lifetime? And that's definitely tough. But on top of that, we've been seeing that as more and more people take measures to treat their fertility issues that they may be having, we've been seeing a real influx of NICU claims. And it's very common for my clients to see $1 million plus NICU claims, and a portion of it can definitely be attributed to the way fertility is treated. But what if there was a better way? Joining us today to learn more about that, we have Jeni Mayorskaya, the founder and CEO of Stork Club. Hey, Jeni, how's it going? Welcome to the show.
Hi, John. Thanks so much for having me. I am just very grateful that you are bringing this topic really up, right? As this industry really needs this advocacy to discuss how we can actually help.
Definitely, and I look forward to our conversation today. So, Jeni, why don't we go right into it, right? So, why don't you tell our audience a little bit about your background and how you came to start the Stork Club?
Absolutely. Well, changing healthcare is very hard, as we all know. So people don't usually just start something like this out of nothing. I personally experienced infertility issues in my early 20s. And I just remember, my doctor told me, hey, with some of the disorders you have, you should expect to get infertility in your later in your life. And my recommendation to you is just drop everything what you're doing right now and go have a husband and a family. And as you can imagine, it's just shocking.
Sure.
And later I've learned that I actually wasn't alone with this type of recommendations, and that it was really shocking to me that humanity developed to this level that we're almost sending missions to Mars, but we still cannot figure out why so many men and women cannot conceive a child. And that was a
Mhm.
very strong motivation to start Club.
No, that's very interesting. So with Stork Club, right, along the way, I mean, like, how long has Stork Club been out there, out of curiosity?
Totally. I think, just having an idea, hey, I would like to provide more transparent guidance, what type of options are available for people, sometime in 2018.
Okay.
And if you remember, that was right before COVID, right? And we all did not expect what's going to happen after. So, of course, like it took us some time to bring this idea to the real life. And I think specifically, I I have experience in technology and had founded companies before in traditional tech. For me, it was really mind blowing how hard it is to start a healthcare company, especially then a part of our model was to design care in a clinical way that it actually drives better outcomes, right? But also contract a national network, and we all know how
Hmm.
much time that takes. So the initial years were just, hey, can we have a solution which is actually working before we go to market and offer it to employers?
Sure. And speaking of which, why don't you tell our audience a little bit about your care model, and if you have any, results that you can share with the audience? I think that'd be very helpful to hear as well.
Absolutely, John. For me, when I started this company, it was very, very important that if I dedicate my life to this mission to improve access and quality of reproductive healthcare in the United States and in the world, that we really lead with innovation and we have evidence-based approach. So there is actually data showing that we are driving better outcomes. And I'm really thrilled that just recently, I think it happened just a few weeks ago, we actually published our outcome study, which shows that Stork Club Fertility Program does outperform all national key benchmarks on specifically fertility care. And so, what it means is we did a study where we compared store club outcomes versus national average outcomes for IVF, in vitro fertilization. And as a result, we basically see that, of course, results slightly different for different age cohorts, right? The older the woman, the fewer chances, unfortunately, we have to end up with a healthy birth. And that analysis per cohort helped us see very clearly that based on this study, the Store Club program does drive significantly more births and babies born with fewer IVF cycles. And so what it means is that on average, and I don't remember exact numbers, but I would say um, ideally you would like fewer IVF cycles so you can achieve birth significantly sooner, right? Because what it's what as a benefit it gives you, you don't have to spend money on just unlimited IVF cycles because they're so expensive. But it's also really emotionally and physically hard to go through those cycles, right? So you want to get to pregnancy and to birth faster. And so Store Club results showing that our members are able to achieve those births 37% sooner, or this is how we see just the reduction of IVF care people need in order to become parents with Store Club. And then there is another outcome. We also see significantly healthier pregnancies. And if I break this down to simplify, you probably heard this phrase. I find especially people in New York say it. They say that IVF is the twin and triplet story, right? Then you just see people who did IVF, they end up in professional language, we call it multiples. And this is what you called out in your introduction, that yes, it's a common story. And the risk for employers is when people go through multiple pregnancy, when it's a twin or a triplet, the studies show that at least half of them, and very often more, will end up in high risk pregnancy, right? And then it's highly likely going to be additional readmissions for the mother. And this is where the bill for employers for care is really growing. But also, it's exposing us to risk of people dropping their jobs, right? A mom who just delivered twins or triplets, that's a lot going on with her health, with the health of the babies, right? And it's really hard just to say like, hey, let's get back to productivity. And so what we see with Store Club program is we we experience 83% reduction in multiple births through IVF. And so what it does, it's actually allowing us reduce the risk of NICU care, to your point, because more mothers end up with singleton births.
That's very interesting right there, and that's something that can be helpful to very many employers out there as they look at what's going on with the NICU claims. One thing I just wanted just to touch on, right? So I'm just going to be candid, Jenny, right? There's a lot of different fertility providers or so-called point solutions in this space. Really, what makes Store Club different compared to some of your competitors out there?
100%, John. And I'm glad you're asking about this because as another healthcare consultant was telling me, hey, there's so much noise in the market and you guys using all the same words that sometimes we really need almost like a PhD in reproductive care in order to understand the difference between clinical programs. So I would say that the model of Store Club is quite unique. And specifically, I would say on the market, I see there are three models how employers can really add fertility care for their employees. The first one is the legacy, right? You can do this through legacy care. And this model, I would say, has multiple limitations. For example, LGBTQ members don't really have access, or this access is limited. Or even heterosexual couples sometimes have to prove that they experience infertility in order to become eligible for this type of treatments. The second model is unmanaged care through reimbursement or HRA model. And this is where patients usually can use a card, a virtual or a physical card, right, with a particular dollar limit on it. And they can purchase any fertility treatments at any fertility clinics. I would say the advantage of this model is that for employers, it might be uh, quite easy to add this type of coverage, right? As a check mark, hey, yes, we do provide fertility coverage. The disadvantage of this model is that very often then people use a dollar-based coverage, especially through HRA model, they might be optimizing to go to the cheaper clinic in order to stretch that coverage, right? And cover 2, 3, or maybe 4 cycles of IVF, because this is how much it would take on average to have a baby born. And as you can see, the incentives are there, not really built in order to drive better outcomes or reduce the amount of care utilized. And especially when people go to mediocre clinics, which are more affordable, unfortunately, Statistically, if you look at the CDC report, for example, in reproductive care, you can see that such clinics unfortunately experience higher risk of multiple births.
Hmm.
And that again drives exposure to the risk of higher NICU cases, right? And high employer claims for overall maternity care. So the third model, as we call it, managed care through the Center of Excellence network, right? What the model involves is it can be either dollar based or it can be a bundle or cycle based limit, right? And basically, there are pre-packaged, pre-designed care sets. That's why it's called bundles or cycle, and they are optimized to drive better clinical outcomes. In short, it because it's managed care, there are included services, so people don't have to think, hey, should I pay additionally for this, let's say, pre-implantation genetic test, or should I not because it costs money, right? Instead, it's designed clinically to include all necessary treatments to drive better outcomes, so again, people don't have to think about this. And those packages are provided through a vetted network, high performance network or a center of excellence network, right? And historically, this model has been used in surgeries, for example, right? Showing that actually going to the best of the best providers does drive better outcomes and overall reduces the cost for employer. So we utilize the same model, and I would say we went even further to innovate. And instead of just the fertility vertical, we expanded to other verticals of care because all stages of reproductive journey are connected, and
Hmm.
actually providing driving the outcomes and excellence at every stage is what's helping employers overall really drive better outcomes and reduce the cost. And specific verticals are fertility care as well as maternity care. And the third vertical is midlife reproductive care, which basically consists of menopause, andropause, and adult gender affirming care. And so you can see that through this model, Store Club currently is the only solution for employer benefits, which offers managed care for Center of Excellence within all three verticals.
Can you tell me a little bit more about the maternity care, what that actually encompasses?
Yeah, absolutely. Well, as you know, John, we are currently in the United States experiencing maternity equity and healthcare crisis. And with some legislation taken in different states, we definitely see a reduction in access to care as well, right? And at Store Club, we consistently working with employers and leading consultants in order to identify those areas and bring solutions which are actually working with validated outcomes. So for maternity care, we've been already providing unlimited visits with doulas and midwives and OBGYNs for our platform. And we were thinking, hey, what's next? How else can we help, especially in those care deserts? And the solution was actually out there. There are so many studies showing that providing access to on site birth doulas significantly improve clinical outcomes for pregnancies and births and actually save lives. And so, what Store Club uniquely provides right now, we provide access to vetted network, national network of birth doulas who actually available not just virtually, which again Store Club has done before, but also come on site. And some people just think about doulas as this is a person who comes during a home birth, right? Or like at a birth center.
Yeah.
But this is actually way more advanced service. Birth doulas are very closely working with doctors in a hospital setting. And their role there is first to prepare a mother before the birth, to create a birthing plan and to become an advocate for the mother, to coach how maybe to manage pain with some of the natural ways, right? How to set mental setting for success, because obviously this is emotionally quite exhausting experience to go for birth. And while in the delivery room and in labor room at a hospital setting, doulas are working very closely with the entire hospital staff, again, to advocate for mother's decision in the birthing plan and just help them to go through so much care and also support them postpartum. And if you look at the statistics, specifically brown and black mothers experience significantly higher maternity death rates, and we see that working with doulas who are the same race, right? And having this really cultural and advocacy connection actually can drive significantly better outcomes specifically for Black and brown mothers and close this gap in care which we all currently experience. And Store Club helps employers to integrate the solution into their health plans. And this model really exceeds this previous generation model where some companies already provide access to doulas through just reimbursement. But as you can imagine, it's so hard for mothers even to educate themselves like, hey, what a doula is, and then go find them, right? And then go contract them and even know like, hey, are those doulas having credentials which they can trust? So we take all of this work, we do all of this, so people can just go and go through this pregnancy and birth experience without thinking if the if this doula has a clear background check, for example.
No, it's very interesting, and something that you kind of touched on that I just want to really hear your opinion on. Is it really possible, and really, what's your perspective on the personalization of care? Is it really realistic to expect personalized care for all? And what do you think is going to really happen over the near future as it relates to personalization of healthcare?
Totally. Well, John, I think we really like it to live in this time when we just see AI blooming, right? And there were so many
Mhm.
changes, there is so much potential. So, what I see is first, personalization really matters, and we can drive significantly better outcomes and have people feeling more loved and supported through this quite an emotional roller coaster journey, right? Specifically, reproductive care. The question is, what is the roadmap, right? What are the opportunities of this, and what's the timeline? And from what Store Club is already doing is we actually collect the data points about gender, race, age of the member in order to provide a personalized care plan. So we actually can see the details, for example, a very important factor for large enterprises, social determinants of health. Again, access to care is really limited for so many people. So, how do we identify specific risk groups and how do we address them specifically? So, because we're collecting these data sets, we're actually broken down in different cohorts and we provide personalized recommendations for the cohorts. And on top of this, we provide, we call it care partnership. So instead of a basic care navigation, we actually use care partners who are clinicians with extensive experience in the industry, and they can provide an additional layer of really personalized care. And what this includes is we understand the conditions of people, right? For example, if someone has diabetes, they will likely see different results for fertility treatments. So, how can we help them, for example, with recommendations on diet management, or maybe working with a physician and understanding what type of medication they're taking and how this is connected to the fertility treatments they're going through? So, for example, our care partners also can be participating in an appointment virtually with the OBGYN who is actually on site and maybe with a physician to better understand overall background of health. And this is what we already do. And I just see that in the very near future, we can start doing so much more and actually provide recommendations for proactive care versus reactive. And I think this is the next front where we can, again, proactively recommend specific genetic testing and based on the condition, understand what may be specific, again, dietary recommendations might be changing the symptoms for menopause. We just had one of our members sharing that just through multiple consultations with the menopause experts, they were able to significantly reduce the symptoms of their menopause without any medication. And this is what I believe is the future of healthcare.
So, talk to me a little bit more about the member experience, right? And I'm a big believer that experience is paramount. And for those in HR, I mean, if a program's not working, you're going to hear about it from your employees. So, why don't you tell me about how the member experience with Stork Club is different and any innovations you may be considering for your model in the future?
Totally. And I like how you're saying, hey, like you'll definitely hear about bad experience. Our customers, when we start working with them, often say, hey, no bad news is great news. And I would be a devil advocate here, and I would say I actually personally believe that if there are no news, you probably like work with just like some program which is hitting the mark, but like ideally you would like to experience like raving comments about the program, right? And that means you are really not just hitting the mark, but exceeding the expectations. But of course, it's very hard to do. Um, as a CEO of the tech company and Stork Club is a tech company, I would say I personally believe that member experience is not just technology. Member experience is a much more comprehensive experience where people feel supported at all stages of the care case and not just through the app, but in real life. And what we do there is because of our model, right? Which is again managed care, we not only refer our members to the high performance clinics, but we actually have our care partners basically holding their hand through the entire care case. And what it means is that through the app, people can request an expedited appointment at the best clinics. And the care partner ensures that the appointment is scheduled, that their drugs delivered on time within just sometimes 24, sometimes even shorter number of hours. And we also ensure paying directly to providers. So, how many times, John, you probably and I definitely used a card for paying for healthcare, like HRA
Yep.
or HSA, right? And it doesn't work. Well, this is like the last thing you want when you just walk up from an IVF procedure, which like took a bunch of hours, right? And you're trying to
Yep.
pay for care, or you're even going for it, and it doesn't work. And the deals are there quite insane. It can be multiple thousands of dollars, right? So we take all of this on Store Club so our members do not have to deal with any of those payments. And then we just add last thing, of course, like this hand holding is just by default standard in the industry, but we don't see that many vendors do that. We pushed even further because we integrate our healthcare with health plans. Our members can see the estimated individual out of pocket cost before they even go for their first appointment.
Hmm.
And we see that this level of transparency of cost and predictability, of course, is really critical for both members as well as in employers. And overall, I see it's very rare that in healthcare industries, vendors have zero customer attrition. And Store Club so far have 100% retention of all our customers from day one. And I find this is a testament to that we're doing something very right.
No, that's definitely huge. And speaking of which, right? So one thing to touch on is there a very specific like employer audience that you're trying to reach? Like, right? Are you trying to do employers with 500 or more employees, 1,000, 10,000? Like, what's your target market?
Yeah, great question. I think, we started early on with working with some small and medium customers. And so far, we see that they're very actively expanding their coverage with us. And as we added more programs such as, again, birth doula, menopause, andropause care, we see that our programs became really beneficial, especially now with validated outcomes and validated methodology of those outcomes for large enterprises. So this year we're focusing to support large enterprises somewhere between 5,000 and 30,000 and slightly higher than that lives covered. And I think it's also important to mention that with this size of companies, they already have people way outside of United States, right? They have offices in so many countries, and this is where we really paid attention and listened to our customers and expanded. So we will be sharing news in the next 10 days about our global milestone we just hit, but I'll like tease it out here that we are ready to support members in 100 countries.
Hmm.
And that, of course, involves us already having care partners hired in those countries, build out playbooks for this, and a really gigantic network of providers in all those countries as well. And you earlier asked me about the difference of Store Club in a crowded space, and I say I don't see that there are just a few vendors who, in general, do provide global coverage. And so far, it's more care navigation, whereas members are referred to some particular clinics, but again, they have to deal with cards or sometimes just pay out of pocket because cards not necessarily working there. We redesigned that experience. And the way we do this is very similar to how we do this in the United States with direct pay. So Store Club deals directly with providers on all the payments, appointments, again, holding the hand of the member. And we see a huge benefit for both employers and employees, again, in member experience as well as better outcomes and reduction of cost overall.
So speaking of costs, right? We may or may not be entering in a recession. I mean, we kind of been flirting with one for the last 2 years or so, right? So as employers, take a look and they take stock of all their different point solutions. How should they really be thinking about reproductive coverage during a potential, economic downturn?
Yeah, yeah. Um, my friends who know me really well, they joke, they say, I was born in Russia, and every 5 years there will be an economical downturn. This is my 10-year living in the United States, and unfortunately, I wasn't surprised. Then we started experiencing the recession we've seen last year, which is kind of non-official recession, right? So I would say we actually designed Store Club specifically to be a successful tool for large enterprises, regardless of their economic situation, to optimize and help them to drive better clinical outcomes while helping them reduce the cost of care overall, not just fertility care, but maternity care as well. And my recommendation to large enterprises in terms of packaging their healthcare and specifically reproductive healthcare in those times is understanding what's really their population look like, and will the company have or gain a competitive advantage in terms of talent, right? Even if companies are planning layoffs, we know, we've seen that before, that these companies very often optimize to still support their existing talent and prevent attrition. And if the social demographics portrait look like that they would benefit from adding this reproductive care, right, it can be really tailored. For example, at Store Club, we don't have to bring all of the three verticals, right? You can start with one and you can supplement what you already have. And then the second recommendation I would give is, I think it's very important to see what's the model of care you're trying to apply, and does it drive validated outcomes in terms of cost control. Because if there are like some studies, but the model itself is not incentivized to really control the cost, but has some gaps and exposure for risk, that risk might be really not a pleasant experience during economical downturns.
Absolutely. So, Jenny, final question for you, right? Let's say there's an employer out there or even an employee and they want to learn a little bit more about Stork Club. Where can they go?
Yeah, totally. Well, first, of course, our website, it's joinstoreclub.com. We also have a blog on our website where you can read more and see some of the numbers I mentioned and results of our studies. And of course, I find that, what we do is not really solve for sales, but it's a strategic partnership. So definitely feel free to reach out to people who work at Store Club over LinkedIn, get to know us. And the next few events, we will be in person, and I'm speaking at the conference where I'll share more details about our doula program. Is going to be Business Group on Health in April 9th. And of course, we will be in the conference board the week of April 15th in New York. So please come to our booth, and very excited to get to know each other and see how we can help.
Well, Jenny, thank you so much for coming on the show today. I really learned a lot, particularly about the doula coverage. That was very insightful.
Thank you so much, John. And thanks for bringing all of those insights to employers' attention. I do believe that we can change healthcare for the better together.
Absolutely. Well, thank you again. And for audience out there, we want to hear from you. Where do you see the future of fertility coverage going? Comment below.